Good morning, ladies. Welcome to this webinar brought to you by Sarah by Wema and Whispa Health. Sarah by Wema is Wema Bank's proposition for women empowerment with focus on entrepreneurs and working women. My name is Abiola Nejo, and I am the head of the Women's Empowerment Platform for Wema Bank. As a bank with a passion of women, we have created several offerings to help support women irrespective of their passion and income. Our offerings are centered around capacity building, access to finance, access to network, mentoring, and lifestyle needs. When it comes to lifestyle, we actually have a value proposition for your health and well-being, because we know at the end of the day, whether you're a businesswoman, whether you're a professional, the health is something that is paramount. And without good health, you are not able to maximize your potential. Like it's commonly said, health is wealth. But I beg to differ, health is health, because we have seen so many people that have this wealth but do not have the health, and of course lost their lives because of that. Back to what I was saying, the reason why we're here, when it comes to the health, the lifestyle, we have created value propositions for you to meet your health and your well-being needs. We have a dedicated product that we also call the Sarah Health Scheme. That is a two-in-one that has the HMO and the cash plan. We're going to be, talking about this much later. So why are we here? Last month, we conducted a survey on sexual health, and we realized that 51% of our respondents are not aware that there's a vaccine for cervical cancer. We've also taken up so many points from this survey that we conducted, and in partnership with Whispa Health, we are going to address these issues one at a time. We've decided also not to wait till December, which we're aware that is the Women's Health Month, because we realized that, between now and October, rather, which is the Women's Health Month, there might be somebody that this webinar would actually change their life. The Center for Disease Control in 2014 reported that the high death rate from cervical cancer is actually the highest for Black women, with 41% higher mortality rate. So this is something that we're going to be talking about. And with me, I have two phenomenal women, pharmacist Morenike and Dr. Ibironke. I'm going to just be giving us a few of their autobiographies so that we understand the type of people that we have with us. Pharmacist Morenike Fajemisi is a multi-award winning pharmacist and the CEO and founder of Whispa Health Limited. She has over 10 years working experience in public health and social marketing, and is passionate about improving the health needs of women. Our mobile app, Whispa, provides reliable, safe, and private space for everyone, particularly women, to ask sexual health questions and get products that can be linked to quality, stigma-free sexual and reproductive health services. She has won several family planning awards, from 120 under 40 top 30 innovation award from World Health Organization Africa, and recently Women Empowerment Award from Bayer Foundation. So help me welcome pharmacist Morenike. Also, we have Dr. Ibironke Ajayi, who is a medical doctor and a key member of the Doctors in Whispa Health app. On Whispa, she provides electronic consulting and consultation on wide variety of healthcare issues, especially those that are sexual and reproductive health related. Dr. Ajayi has years of experience working in various clinical sectors, both private and public, and she's worked with Global Funds and APIN between 2018 and 2019 in management of HIV and AIDS patients in Lagos. She has also worked on cervical cancer screening program organized by Lagos State Government and CHI, with a view of reducing the prevalence of cervical cancer in Nigeria. I think at this point, I would just like us to invite our friends, our relatives, any woman in your life. This is a good time for you to invite them. Our question and answer section are open. If you have any question, please feel free to drop your questions in this chat box and we'll respond to you. Welcome again, and Morenike, over to you.
So today we're discussing cancer, and specifically cervical cancer. So cancer is a disease in which basically cells of the body are growing out of control. They are behaving abnormally. That's a very, simple summary of what cancer is. And usually cancer is named after whichever body part it starts from. So even though cancer can spread and get to other parts of the body, if it starts from the breast, it's called breast cancer. And in this case, if it starts from the cervix, it's called cervical cancer. So Dr. What's her name? Abiola mentioned briefly about how serious cervical cancer is. I'd like to also mention that together with the other two female-centric cancers, which is breast cancer and ovarian cancer, it makes up for the largest amount of cancer-related deaths in women. And this is particularly in women in developing countries like ours. Cervical cancer in particular is the second highest cause of cancer-related death in women. And what's especially interesting about this topic is the fact that many people have never heard about cervical cancer. So how do you prevent something that you have no clue about, that you're probably hearing about for the first time? How do you fight something that you don't know of? So I'm going to hand the baton to Dr. Ronke, my colleague at Whispa, to speak to cervical cancer itself. What is the cervix? What is cervical cancer? So just briefly tell us, what's the cervix? Why is it important? What's the big deal about it? Thank you.
Thank you very much, Famreni. Good morning, everyone. My name is Dr. Ronke Ajayi. So what is cervical cancer? Cervical cancer is the third leading cause of cancer amongst women globally. And as we all know, definitely cervical cancer, so it's caused by cancer of the cervix. So what is the cervix? The cervix is like a passage between the vagina and the womb. The womb is what we call the uterus in medicine, the womb. So it's that place that connects, it's like a bridge between the vagina and the uterus. And it mostly consists of tissues, and there are two parts to the cervix. We have the ectocervix, which is like ecto outside, then the endocervix inside. So although the cervix cannot be seen with the normal eye, so you need to look in through the vagina. So the ectocervix is that part that is, when you look in through the vagina, that part you see immediately. Let's say you use something we call the speculum. The speculum is something we use to view. We pass it in through the vagina. That's where you see the ectocervix. Then the endocervix is the one on the other side, because the way the cervix is built is like a cylindrical structure. So there is the outside and the inside. So on coming in from outside through the vagina, you first see the ectocervix. Then after that, on the other side, the part leading to the womb, which is the uterus, is where you see the endocervix. So that's really about it with the cervix. But
I'm curious, what makes the cervix so important? Like, to the general public, what's the big deal about the cervix?
Okay. So like I said, I already called it a passage. So it's very important in fertility. I mean, when there's a sexual intercourse, that's where the sperm flows through. When it goes through the vagina, it goes through the cervix into the uterus. So it's a very important fertility organ.
Okay, good. All right. So now that we've established that this previously never seen before body parts is this important, can you tell us, with respect to the subject, which is cervical cancer, can you tell us what type of screenings, like how does one detect cervical cancer early?
Okay. So there are several ways, but the commonest one is through the pap smear. So there's something called the pap smear, which is where they take parts. They use something like a layman's and something like what they call a cutting board. It's like a swab stick. Yes. So it's like your cutting board, laymanly. So that's what you take. You put it through the vagina and go up, and then you take a sample. That's what the pap smear is about. So through that, they can view it under the microscope and look at the cells. So when it changes and all that, the pathologist can inform us, oh, there is a change in what the normal is and the abnormal. Then there is also the visual inspection. This one is just we using something we call the acetic acid on examination. This can be done by anybody that is trained for it. It doesn't have to be the pathologist because you're not getting any sample out. So basically, you just look in, you spray it with something, with the acetic acid, like I explained. So there's supposed to be a change. So if there is that change, then you know that, oh, there's a problem. There is a change in what this cell should look like. There is a problem with that. Then recently, there's also been something we call human papilloma virus, which is the major cause, we will come to that, which is the major cause of cervical cancer in the first place. So studies have shown that you can actually check for the virus itself in the body. So these are the commonest causes, the commonest ways of checking.
Okay, so yes, you're right. We totally missed a very important topic. What causes cervical cancer? What's the major cause, like you said? I'm sure some people have only heard of maybe HIV, and now you've just mentioned the virus that is new to the ear for a lot of people. So what is the cause, for the most part, of cervical cancer?
Okay, thank you very much. For cervical cancer, like any other cancer, it's caused by varieties of things, you know. But for the cervical cancer, there is something in particular, which is the human papilloma virus. That's the HPV virus, which has been known, which has been studied over the years to be a major cause of cervical cancer. Now, there are several types of human papilloma virus, you know. There are several strains of it, just like we're hearing COVID-19 has several strains. Yes, so we have the ones that might cause things we know as warts or several things. But for the cervical cancer, we have strain 16 and 18. So these are the two ones that have been implicated in cervical cancer, you know. So, and it's usually gotten from sexual intercourse. Then, so that brings me to other things as well that can cause. There is the genetic aspect of cervical cancer, which will cause hereditary as well. Also, like I said, human papilloma virus is gotten from sexual intercourse. So we know that when someone has unprotected, that's the key word, unprotected sexual intercourse, you're likely to get it. Also, for people that start having sex at an earlier age, they are also likely to get it earlier, because I mean, compare it with someone that started having sex at 21 with someone that started having at 14. That 14-year-old has been exposed more to different things. So yes, as well. So that's about that. Most importantly is the human papilloma virus.
The human papilloma virus. Interesting. And you mentioned that there are some particular types of the human papilloma virus, right? That are responsible where cervical cancer is concerned.
Yes, type 16 and 18.
There's a question we often get in Whispa whenever we're talking about screening, and it has to do with pain. Is this screening process painful? What do you think about it, at least from experiences of clients? What's it like? And I'd like you to compare both, because you said there's two major types, the visual one and the pap smears. So just talk about pain. Should people be worried?
So to be honest, I won't call it pain. It's not pain. It's something called discomfort. It's just like some sort of this, you just feel like something is going in there, not like you are feeling pain at all. So it's not painful, it's just some sort of discomfort, because for the pap smear, like I said earlier, that the cervix cannot be viewed with just the human eye. So they need to pass the speculum, you know. So it's in the process of passing the speculum, you might feel some discomfort, like something is going into your body. So it's not pain, it's just discomfort. Even with the visual inspection as well, no form of pain. You just feel like, okay, well, when the acetic acid is sprayed, you might just feel a sting, just a little, but that's not pain. That's not pain.
But let's assume some people have very low pain threshold, so they might feel some pain.
It can be tolerated.
It can be tolerated. Okay, that's very good to know. Thank you. Okay, so back to the subject of screening. Who can get screened? Who should get screened? It's important to, you know, have that understanding broadly. And also, well, let's take it one after the other. Who can get screened? Who should get screened?
Okay, so we usually say from 21 years and above should get screened. However, I like to say there are exceptions to this. So like I gave an example of a 14-year-old that started intercourse before a 21-year-old. we definitely know that we should screen a 14-year-old. We should screen a 14-year-old earlier than 21 if she has been exposed to sexual intercourse at an earlier age. But globally, we say 21 years and above. Also, there's an exception for HIV positive patients. You screen them earlier as well because they are more prone to HPV, yes. So from 21 to 65, we can screen.
Okay. Okay. So when you say HIV positive clients should get screened earlier, is it just because they are more likely to get HPV or other infections in general?
Yes, because they are prone to, we all know that their immune system, they are immunosuppressed. That's the word. They are immunosuppressed. So they don't have the things we have to fight other things and to fight infections in the body. So because of that, they are more prone to them not being able to wall off any form of infection from their body. So because of this, we screen them earlier.
Okay, so this even brings me to a related topic. Is it every single person that gets HPV that is eventually going to progress to cervical cancer? Is there any role the immune system plays at time in defending the body?
Yes, it does. You know, a lot of times, even as little as cold, even as little as, I keep going back to COVID-19 because that is what we all have. That's what's going on present. So, you know, some people will get COVID-19 and they will just get mild symptoms, while some people will get COVID-19 and end up in the ICU. Some people are even dying. People are dying from it. So it still boils down to the immune system. Not everybody that gets infected with HPV would have cervical cancer. Not everybody that gets infected. So yes, so the immune system plays a role, major role in that as well. Yes, I think I don't need to answer the question.
Yes, it does. It does. Thank you very much for that. Would you also say that, so I've heard that there are other things that might increase the risk, maybe frequent or having several sexual partners, for example. What other factors could possibly increase someone's risk? You've also pointed out that someone with, let's say, poorly managed HIV can have an increase. Is there any other factor that you might have skipped over that you want to mention?
Like I said, sex at a young age.
Okay.
Multiple sexual partners, unprotected sexual intercourse, you know. Then there's also something about having history of sexually transmitted diseases in the past. As well. When you have that, when there's a frequency of increase in your sexually transmitted disease and that was not well treated, you know, that also plays a role. Yes,
it can make it easier for such a person.
Easier for human papilloma virus to thrive.
Interesting. Okay, thank you very much for clarifying that. So we've talked about screening, right, as one of the ways to prevent. What's the other way to prevent cervical cancer?
Thank you very much for that question. It's the vaccine. There's a vaccine for cervical cancer, which usually works better when it's taken before starting sexual intercourse at all. That's why we preach once a child from 9 years old, female children can have it. From 9 years old, they can. So because it works better when the body has not even been exposed to any form of intercourse or any form of virus at all. You know, so yes, so we have the cervical cancer vaccine. So there are two types that we know of, but in this part of our climb, the first one, there are two types. We have the Cervix, we have Gardasil. So Cervix is targeted towards the types, and you know, I told you there are strains of the human papilloma virus. So the Cervix is targeted to the two important strains that causes human papilloma virus. While Gardasil also has extra strains, so it targets 4 strains. In case it also protects against the other strains that causes other things that are not cervical cancer. But from research, it's been shown that because the Cervix targets just those 2 strains, they are actually better, much more efficient in fighting cervical cancer than the Gardasil. So I think Cervix suffices. Cervix suffices.
So it's more like it has a bit more specificity for cervical cancer.
Thank you. Yes.
Perfect. I also want to mention that I'm aware that there's actually one more type of vaccine. It's called Gardasil 9, and this one is supposed to target 9 strains of cervical cancer. However, in Nigeria, what's
Yeah,
readily
in Nigeria
available,
now, we don't
yeah,
get all these things.
what's readily available for those who are listening is Cervix. And I mean, that's what the topic is about. It's about preventing cervical cancer for women. So it is not just available, it's on point, it's spot on. There's a question someone mentioned. I'd like us to quickly address it because it's on topic and very important. Are there any, we'll come back to the subject of vaccination. I want to speak to that in particular. But are there any symptoms of cervical cancer that one could, possibly notice, especially if you're not able to detect it early?
Okay. For cervical cancer, the symptoms, one of the common symptoms we see are bleeding,
So
you just tend to
I've heard of people who bleed after sex. Is that something to?
Yes. It's also, yes, thank you. So we have those people that immediately after sexual intercourse, they tend to bleed. They tend to bleed after that. And even without sexual intercourse also, they are just bleeding that is not related to your period, or you have elongated menstrual cycle as well. Yes.
But are these foolproof ways? Is this something someone should rely on and say, oh, okay, I'm looking out for symptoms, I don't want to get screened?
No, please, because for cervical cancer, by the time you are seeing all these things, you are most likely at a stage that is not good.
Okay, so
that's the thing I forgot to mention for cervical cancer. For cervical cancer, there's that kind of cancer where early detection helps. Early detection helps because by the time you are having symptoms, it's asymptomatic. Yes, what I was trying to say is that it's asymptomatic at the early stages. So you most likely won't have symptoms at the early stages. By the time you're having symptoms, you're probably at the 4th stage, the 3rd stage. Yes.
So everyone listening, the goal is to actually catch the cancer when it's not showing symptoms. So exactly. If you are used to saying, I want to look for symptoms before I seek healthcare, it doesn't apply to this topic. If you're seeking healthcare at that stage, then you are running the risk that it could turn fatal. So it could lead to death. Okay. So advanced cases and the stage you're looking out for. Okay. Exactly. So I want to quickly expatiate a bit. If you can give me a few minutes, Dr. Runke, on the vaccination. So for those listening, the vaccine Cervix is recommended currently for girls and women aged 9 to 45 years old. The age range was expanded. It used to just be 9 to 25, but it was expanded because really age at sexual activity varies. So there isn't necessarily a guarantee that someone who is 40 is even as sexually experienced as someone who's in their 20s sometimes. Furthermore, there were additional studies carried out that showed that they could extend the age range for vaccination and still have some benefit. That said, just like Dr. Runke mentioned, the earlier the better. There's so many things in this life that you need to do it soon. So it's also one of the reasons why when it's given to younger females, so those who are between 9 to 14 years old, they only need 2 doses of the vaccine taken 6 months apart. Whereas the recommendation for those who are 15 years and above is to get 3 doses of the vaccine also taken within a 6-month window. So where we're going with this is it's highly beneficial, especially for mothers with daughters who are approaching their teenage years. Think of it as protecting their future. Think of it as ensuring that before they have first sex, whether it's within marriage or outside marriage. So this is where the sexual health importance and messaging is very key. That you shouldn't think of it as I'm giving them a vaccine for something that can only be that is transmitted sexually. No, they will get to some point in their life where they will have sex, right? So think of it as I'm giving them a vaccine that is protecting their future. So it's very important. And it also saves you a lot of money think about it that way as well, because you're only having to give your child 2 doses. This brings me to another common question we hear parents ask. They say, oh, we must have gotten it during the childhood vaccines. These are not childhood vaccination schedules. Nobody gives cervical cancer vaccines to kids below 9 because the WHO recommendation doesn't have such approval. So it's 100% certain that your child did not get it as part of their routine under age 5 childhood vaccination. So at the moment, as we mentioned, eligibility is from 9 to 45 because that's where the studies have been done. But there are different number of doses for the kids who are 9 to 14, 2 doses, versus those who are 15 plus. Having said that, sometimes it also requires a discussion between the doctor and the client to figure out what's best, even despite the age. So I'm bringing back to that point Dr. Runke made about someone who is 14 or 15 and already sexually active. So there are exceptions, and that's best discussed with the doctor during your appointment. We will speak to how you can get the vaccine, how you can get screened later on in this conversation. I will also open the floor for questions. So with respect to screening, I'm going to throw the ball back to Dr. Runke's court. When people screen, what are the likely outcomes results-wise? And what's the next steps based on the results that they can get?
Okay. The first one we all pray for is normal. So when it's normal, it's advised that we screen every 3 years.
Okay.
Every 3 years if it's normal. But the other option is for us to have something we call pre-cancerous lesions. Let me just put it that way. So this is not fully formed cancer, like I said. This is you saying, this doesn't look like normal, but it's not cancer. But if we leave it, it will become cancer. So
okay,
that's what we call pre-cancerous lesions. And like I just want to clarify, I want to reach that by the time you are seeing these precancerous lesions, you won't even have symptoms yet. So that's why, thank you for bringing that up. Nobody should wait till they have symptoms for cervical cancer at all. So yeah, I've mentioned that when you check and it's normal 3 years, then when we have precancerous lesions, we have treatment options available for that, you know. So the first one is what we call the LEEP. The LEEP, that's the loop electrosurgical excision. So that one is, it's after you treat, then after you check, you can discuss with the doctor, someone that has been trained for that, mostly doctors, yes. So it's like saying, we're going to take out an aspect of that place that they see an aberration. So the aspect of the cervix where they see doesn't look normal will be taken out, just a little bit, so taken out. That's what we call the LEEP. Then we also have the cryotherapy. That's another option as well for the precancerous lesions. That one is using something like a, how do I call it? Like a freezing, like you freeze out that part of the lesion. So that's cryotherapy. So these are the commonest ones that we have presently in Nigeria.
Okay, thank you for that. Okay, so to bring it back to everyone's understanding, you're saying that if the results are normal, it's recommended that you still continue checking.
Continue to check it
every 3 years.
Absolutely.
Okay, but if the results are abnormal and what is found is precancerous lesions, so not fully formed cancer, but something that's definitely going to turn into cancer,
yes,
they can actually have it treated at that stage.
Yes.
Wow. Okay. Thank you for clarifying. And that the two means of treating is the cryotherapy and the LEEP presently
Yes.
in Nigeria. Okay.
Yes.
Now there's a third scenario. What if the results are abnormal and already cancerous? What happens?
So for that, it's a multidisciplinary approach. You're going to involve the oncologist, the gynecologist. That's when chemotherapy comes in, radiotherapy comes in, surgery as well, you know. So first of all, I know they'll likely do, that's why I said it's a multidisciplinary approach. They'll do a surgery where they'll probably say, see, especially if they weigh the age and all that, they'll say, okay, let's go in, let's take out the uterus, the cervix, the vagina. They do a full removal of everything, you know. But at this point as well, because it's already cancerous, that's most likely spread to other parts. So that's where the chemotherapy comes in, the radiotherapy comes in, because you need to kill it in those parts where it has spread to.
Okay, so sorry to clarify, you're saying that it's possible that they can remove every single reproductive organ?
Yes.
Okay, and you're saying that that's still not a guarantee that it's going to
No,
kill?
it's not.
Oh, wow. Okay. And is chemotherapy also guaranteed? Like, okay, yes, the person has a cancer, yes, but they are sure of the outcome. Is that guaranteed there?
It's not at all. It's not. That's why we are here. If it was guaranteed, I'm sure we'll be here if I'm ready. We'll be here trying to prevent people from getting it in the first place. So it's not.
Okay, and it also explains why cervical cancer is leading to a lot of premature deaths in this part of the world. Whereas in other parts of the world where routine screening and vaccination is like easy, is well talked about. It's probably not as common. So it's not like their bodies are better than ours. It's just the awareness. Right?
It's just awareness. It's awareness.
Sadly. Okay. So I'm glad there's so many people here who are aware now, and I'm hoping that you are able to, you know, tell others as well that routine screening and vaccination is key where cervical cancer is concerned. So the treatments, how long does it typically take? This is just to kind of give people an idea. If it's just precancerous lesions. Is this something that takes months to get resolved, or it's a pretty quick process?
Oh, like I said, it's straightforward if it's precancerous. You know, they just come in, you check. When it's that, they do what they need to do. If it's the lip option, depending on how advanced it is, because for the lip, it has a particular portion of the cervix that it must not have exceeded for them to do a lip. And for the cryotherapy, it has a portion as well that it mustn't have exceeded for them to do that. So it's something that you come in, you do the procedure, and you can go home. They just advise you during that period, don't have sexual intercourse and all that, because during that period, you would probably have a lot of discharge, you know, from the procedure. Then after that, it's just follow up, checking again to see.
Okay. So this is another thing that is highlighting a case for early detection. Can you compare this to someone who actually shows up at an advanced stage and has cancer? On average, how long does the process take? We've already established the process might still not work out, but how long can it take compared to? It's like comparing. How is it to compare?
Like comparing sleep and death, like it's just so far apart. No, is it the emotional struggle? Is it the financial aspect? Is it the physical aspect? Because apart from the cancer itself, the treatment as well. So it's just, you can't quantify really. It takes months, some people years. And even after doing all of that, there's a tendency for you to relapse. There's a tendency for reoccurrence and all that. So no, you can't really say how long.
Oh, wow. Okay, interesting. All right. So I'm going to start. I will allow us to take a few questions before we close with where you can get screened and vaccinated. So there's a question about if you've never been sexually active and it's been over, and you're already over 40 years, are you at risk of getting HPV or cervical cancer? So you can also adjust this question to say, how high is your risk of getting HPV and cervical cancer?
Okay. So like we said that HPV is not the only cause of cervical cancer. So even though you have not been sexually active, you should still get screened for cervical cancer, because there are other things as well that would cause cervical cancer. HPV is just the major thing. So because of those things, yes, we still advise you to go ahead and screen for cervical cancer.
All right, brilliant. Thank you. I'll go to another question. I'm going to juggle between the chat box and the Q&A. So this is a question about how regular, so this is advanced stage symptoms. Is there a certain regularity to the bleeding before you start getting worried? This is a lot of questions, so we'll take one after the other. Okay, right. So how regular can this bleeding be before you get worried?
I'm not sure I understand what the person means by how regular. Is it how often the person should bleed before you get worried? Because ideally, once you are bleeding after sexual intercourse, you should be worried.
Immediately.
It's not normal.
You shouldn't count it. Okay, established.
You shouldn't in the first place.
Okay, okay. So this is a question about so someone's wife had to go for a pap smear after their child was a year old. This is because they finally heard about it from a medical practitioner. He said, shouldn't this be the norm? That they had never heard about it before from any other medical practitioner. So what do you say to that?
Well, that's why we are awareness. We never stop at doing awareness. You just keep talking about it. We just keep talking about it. It's possible she has not heard it before, but I'm sure most times these days, even after giving birth, at least in my facility, once they are offering you family planning after giving birth, they're also telling you about pap smear, about cervical cancer screening. So yes, it's becoming the norm. You know, awareness is becoming the norm. We'll keep talking about it till everybody hears about it.
Awareness is a marathon. It's not a sprint. Everybody, different efforts. You hear about it today from us, and hopefully we hear about it from someone else. We can't rule out that human beings might forget sometimes, but you are here now. So also join the awareness train, right? And tell others. You are breaking. Hello? Okay, so there's a question that can cervical cancer vaccination also help prevent other HPV related cancers?
Oh.
Hello, did you hear me? Hello?
Can cervical cancer vaccination, can you hear me?
Yes, now we can hear you. Please go ahead.
Hello, I'm here.
Yes, we can hear you. Can cervical cancer vaccination, which is protecting against type 16 and 18, can it help protect
I said
against...
about cancer.
Oh, the network for some reason. I can hear you now, so if you can go ahead again. Hello? Okay, so I'm going to respond pending when Dr. Ajayi's network comes back. Because the vaccine that is available is targeting type 16 and 18. These are the types that have been implicated in cervical cancer. It doesn't actually help against the other cancers. So other cancers and other conditions that are commonly caused by HPV, you have anal cancer, you have genital warts, which is actually super common, and you have penile cancer and other types of cancers, oral cancer as well. But this would require you to get the other type of vaccine that isn't readily available, which is the Gardasil and Gardasil 9. We say it's not readily available because when it is available, it tends to also cost in the range of about $100K per dose. So it's not it's not readily available or affordable. But if you're ever outside the country, I would recommend that you look out for those, for the Gardasil, because they do provide a broader coverage than just the cervical cancer protection. So the process for getting the vaccine, and okay, this is a common question. Let me answer that first. If you're above 50 years, can you be vaccinated? Current recommendation stops at 45 years. This is important because medicine, we stick to current recommendation, which is that's what it's been tested for. And that's the age group where there has been some benefits. This is not to say you cannot insist after discussing with your doctor that you want to get vaccinated, but you are going into it with the understanding that you are likely not to reap as much benefit because your immune system may not be as responsive as someone who is younger. It's also why those who are 9 to 14 years only need 2 doses, because they have the best immune response at that age. So it's not a way of discriminating or cutting off some age groups. It's medicine and medical professionals deciding that vaccines should be given to those who can benefit from it the most. So you're not wasting your money, and so that it's actually doing what it's designed to do. I also want to clarify that these vaccines are not, what's the word? They cannot treat cervical cancer. They cannot treat HPV. They are preventive. And even at that, any medicine, and this isn't even unique to vaccine, there is no 100% guarantee that it's not going to, that you can't get cervical cancer from other sources just because you've taken the Cervix cervical cancer vaccine. So it will protect you over 95% of the time, but it's not 100%, right? And it will not treat. So we see cases of people who already have run tests that have diagnosed them with one form of HPV or the other, now seeking vaccines thinking it's going to cure them. It doesn't work that way. So we encourage you to get screened regularly, get vaccinated, and seek treatment if you are still at a stage where you can seek treatment for the lesions.
Am I back? I don't know if you can hear me.
Yes, you're back. Thank you. All right. So can you get the vaccine without screening? It's not recommended. But the answer is currently yes, but it's not recommended. You will be counseled not to do that during your appointments. So I'm going to drop a message in the chat. We have a link for those who are in Lagos to book any of these appointments, including the cervical cancer vaccine. It's whispa.ng/appointments. If you're outside Lagos, because we are currently we are adding people to our wait list for locations in Abuja, Port Harcourt, Delta, and Edo, I would encourage you to call us on 0809-4477-226. I hope I got that. So you can reach Whispa through any of these channels to book your cervical cancer screening and vaccination. So the question on the cost, at the moment in Lagos, it's 15,000 naira per dose. And like we mentioned, if you're 9 to 14, you need 2 doses. And if the girl or woman is 15 and above, they need 3 doses. But in Lagos, we're also running a promotional offer where you are able to get screened for free. For those outside Lagos, not to worry, we'll let you know what the cost is once you call that number and get yourself added to the wait list, because we'll be booking clients in the next 2 weeks. So If you are not in any of the states we've mentioned, we'll recommend that you check a health center or teaching hospital near you to find
or a general hospital.
or a general hospital, thank you, to find out what they have in place when it comes to screening, at least, because it's not everywhere that they also have the vaccines. Am I right, Dr. Runke?
Yes, it's not everywhere.
At the least, they do have screening, which you can key into. So Lagos, Abuja, Edo, Delta, Rivers, so Port Harcourt, I don't know if I missed any other states, but easily do call us and just let us know so you get on the wait list. That way you get the full answer. So it's 00944 77226. And the link I also dropped in the chat. So let's go back to the Q&As. If you've given birth, can you still do screening and vaccination, Dr. Runke?
Absolutely, please, yes.
Okay, perfect. So we've answered that. That childbirth doesn't exclude you from screening. I will, however, point out that pregnant women, for obvious reasons, we don't want anybody opening their legs and looking at their cervix. So for obvious reasons, right, pregnant women are excluded. But
usually say 6 weeks after delivery, I'm coming.
Good, thank you. So 6 weeks after delivery, did you guys hear that? You can come in for the vaccines and screening. Now, sorry, for the screening. For vaccination, with pregnant women, it's not recommended to give this vaccine. There's a contraindication. So if you do want the vaccine, we advise you to wait and give birth. Now, if you do give birth and you are exclusively breastfeeding, there is, it's a decision between you and your doctor, but there is a necessary conversation to have whether you're going to come back in 6 months' time or you can have it immediately. But that usually applies to women who are exclusively breastfeeding. As you know, the window for exclusive breastfeeding is 6 months. And that means that the baby is taking no other thing, not even water, only breast milk. So most people aren't exclusive. They claim they are, but they aren't because the baby's still taking water or pap or whatever.
Yeah, I'm giving water. And they'll tell you this.
So we know that that's not true for a lot of women, and there's nothing wrong with combining, breast milk with formula. In the end, we are aiming for well-fed babies, but we are clarifying what the definition of exclusive breastfeeding is. Okay. Is there a screening location in Ibadan? Please call that number. We'll be able to confirm or put you on the wait list as soon as we have one. So someone is asking that, how is the doctor going to differentiate precancerous lesions from STD lesions in the vulva? I guess it's the doctor's job to do that.
I think that's the work of the pathologist.
Yes. So don't self-diagnose. I think that's the important thing to say here. Nigeria is a place where we do a lot of self-diagnosis. This isn't the kind of case to attempt to self-diagnose. Okay, so we've answered that. I really do need to close. Does the vaccine make you more susceptible to HIV infection? Okay.
No.
Okay, thank you. So rather, HIV infection, as Dr. Runke said, can make you more susceptible to HPV and many other vaccines and many other, infections, both bacteria and viruses. I didn't mean to say vaccine, scratch that. And this is also why at Whispa. So I'll speak a bit to what we do. We have a mobile application. On it, we allow people chat with doctors, ask any question at all. So if you want to speak with Dr. Ronke, for example, you can easily find her on Whispa mobile app. Now, in addition, we also book appointments for even routine STI screening. So because this is a sexual health session, I'm also talking to this because apart from routine screening for HPV, there are quite a number of common sexually transmitted infections, especially those that can cause infertility that people don't check for. So we have a routine screening test. It checks for the usual suspects, chlamydia, gonorrhea, syphilis, and the like. And it's just 10,000 naira. So if you also go to this same link, whisper.ng/appointment, you can easily see all the tests that are available, pick a location, and we'll call you to pick your preferred dates. So we've answered that question. If there's any question in the chat, I'm afraid we might not see it. So if you could drop your questions in the Q&A box, that would actually be easy to find. So if you do the screening, there's a question about, can you take the vaccine? I'm not sure I understand the question, but let me clarify that if you do the visual screenings, you can usually see your result that same day or that same instant, or get your results and also get vaccinated.
Okay, I'd like to clarify something as well.
Okay, please go ahead.
Sorry. For the visual inspection, we usually say because it's subjective, so even when you do visual inspections and they see an abnormal thing, it's still advisable for you to get a pap smear.
Okay, thank you.
Before getting, yes.
Okay. So it's common to get your vaccine on the same day if it's a VIA, but if it's a pap smear, because the samples have to be sent over to a laboratory, it can take anything from 2 to 3 weeks for the results to come back. But just like Dr. Ronke mentioned, the pap smear is way more accurate than the visual inspection. What we have done at Whispa is to partner with people who do the VIA regularly and frequently, so that they have that level of experience. Thank you. And to improve the quality of the VIA process. So this is different from going to meet someone who maybe does 1 VIA in a year or 2 VIAs in a year. It's not to say that they don't know what to do, but because it's a visual inspection, the more patients you see, the more likely you are given accurate results. But it's the gold star if you can go for the pap smear or afford to go for the pap smear. Dr. Ajayi, very important question. If you have never had sex before, so a virgin or a vaginal virgin, because there's different types these days, can you get, yes, can you get a pap smear?
No, we usually don't want to. We don't allow pap smear for virgins because, I mean, like I explained how to get pap smear done, you need to pass a speculum. And we don't want anybody saying we thought the hymen or with the flat somebody. So because of that, we don't advise for you to, no.
Okay. But to clarify, it's not like if the person has an understanding that this is a medical procedure, if the person is not finicky, so to say, about whether they have a hymen or not, is it still possible, like anatomically, to give them a pap smear? So can it be up to the clients if they have an understanding?
Yes. Up to the client and sign the necessary documents. Because I've heard of situations where they say, "Oh, please go ahead," and later in future they sue the person.
They say the doctor that is virgin.
The doctor, yes.
So I want to quickly speak to even just a one-liner about this whole virginity matter. Let it be clear that the hymen isn't present in everybody. So even without having done a medical procedure, you might have your first sex and not bleed because your hymen either was not there, or you lost it through even regular activities like dancing or climbing Okada.
Yes, or even eating.
Or even what?
Eating.
Look at that. So there are so many ways other than intercourse, like people think that the hymen can go, and it's not everybody that was even born with one in the first place.
Exactly.
So if you think about it that way, and you are able to say, oh, in that case, no problem, I want to go ahead. Like Dr. Ajayi said, you might be required to sign that you've given a consent for the procedure to be done, even though you've never had sex before. But physically, there's nothing wrong with you getting it done.
Yes.
Okay. If you are okay, do we need to register for the free screening? The free screening at this time is being given to those who have paid for the vaccine. So it's not a standalone. I just want to clarify. And it's currently available in Lagos. We're going to announce if we're going to make that available in the other states. If not, screening usually costs anything from 3,000 naira to 12,000 naira, depending on whether it's a VIA or the pap smear. So it's also fairly affordable. Okay, so that's answered that question. Someone says they are 46 this year. Can they still get the vaccine? It would be a discussion between you and the doctor, because you'd have to recognize that you are past the age where it's being recommended for. So there aren't enough studies to prove that it's going to be beneficial to someone above 45. So if you don't mind making the expense, the doctor might still go ahead. So the link, again, I'm typing it in the box because I keep seeing several questions. The link and the phone number you can call is whisper.ng/appointment.
It's up there so we don't keep typing.
I don't think there's a way to pin, unfortunately.
Okay.
Unless the hosts know how to help me do that, or they can call 226. And we will also be sending a communication out to everyone who registered for this session, so that you can have some of all these bullet points we've mentioned today summarized for you, as well as information on how to get to us. So I think just look out for that email. That's another good way to find us. Okay, the questions keep increasing. How much is the vaccine? 15K per dose. So 45, well, we have discounts if you're paying at once, but it does come to 45K for 3 doses if you are paying in bits. We recommend you just pay for all your doses at once so that you can truly get the discounts. So that's the answer to that. And the free screening is for those who have paid for vaccines. If not, you'd have to pay for your screening separately. Thank you. What else? We are skipping. Okay, can men take the vaccine? So, very, very good question. And it's a question that is a subject of
controversy.
Yes, so men can take the other type of the vaccine, the Gardasil, but we do not have them at the moment. So that's the issue. In fact, boys are being vaccinated at the moment as well as girls in many developed countries. As soon as it becomes readily available in Nigeria, we will make it available. And in fact, you can also call that number and join our wait list of men who want to get Gardasil when it becomes available. So do call the number in the chats. Okay. we've answered all questions on location. Call that number or go to the link. I'm just closing questions that we haven't answered. Okay, I think we're coming to a close, everyone. We've taken most of the questions are reoccurring at this point. I'll